Hi, in today's video, I would like to take some time and answer a question asked by many. Is autism caused by complications during pregnancy? As always, before we get started, please make sure to hit the subscribe button so you don't miss any of the information I'll be sharing about autism in my weekly videos. As I mentioned quite often in my previous videos, autism is a complex neurodevelopmental disorder that affects communication, social interaction, and behavior. While the exact cause of autism is not fully understood, research has shown that it likely involves a combination of genetic and environmental factors. There is some evidence to suggest that complications during pregnancy, such as exposure to toxins or infections, may increase the risk of autism. However, it is important to note that not all individuals with autism have experienced complication during pregnancy, and not all individuals who experience complications during pregnancy develop autism. One study published in the Journal of Autism and Developmental Disorders found that children born to mothers who had complications during pregnancy, such as gestational diabetes, hypertension, and bleeding, were more likely to develop autism than those without complications. Despite that, the study also found that these complications were relatively rare, occurring in only about 5% of all pregnancies. Another study published in JAMA Psychiatry found that exposure to certain infections during pregnancy, such as influenza or herpes, was associated with an increased risk of autism in offspring. However, this study also noted that the absolute risk of autism associated with these infections was relatively small. While there is some evidence to suggest that complications during pregnancy may increase the risk of autism, it is important to note that this is just one of many factors that may contribute to the development of the disorder. Other factors such as genetics, environmental toxins, and prenatal nutrition may also play a role. Additionally, not all individuals with autism have experienced complications during pregnancy, and not all individuals who experience complications during pregnancy develop autism. While these studies suggest that complications during pregnancy may increase the risk of autism, it is important to note that the exact cause of the disorder is not fully understood and likely involves a combination of genetic and environmental factors. I hope this video provided you with a clear answer to the question, is autism caused by complications during pregnancy? If you have any questions, make sure you type them in the comments below, and I will do my best to get back to you. Thank you for watching. I will see you in the next video.